Spotting breast cancer early. 9 warning signs every woman should know. Breast cancer is one of the most common cancers affecting women worldwide. While the thought of it may be frightening, early detection can significantly improve outcomes and even save lives. In this video, we'll guide you through the 9 key warning signs of breast cancer, helping you become more attuned to your body and more confident about seeking medical attention when necessary. Knowledge is truly power, and we're here to ensure you're equipped to take proactive steps for your health. Let's break down the critical symptoms, bust some common myths, and leave you with simple actions you can take to stay ahead in the fight against breast cancer. Early detection is not just important, it's life-saving. The earlier breast cancer is diagnosed, the better the chances of successful treatment and recovery. According to studies, the 5-year survival rate for localized breast cancer detected early is up to 99%. In contrast, late-stage detection often leaves fewer treatment options, and survival rates drop significantly. This is why it's vital not to ignore unusual changes in your body, no matter how small or insignificant they seem. Fear or denial shouldn't hold anyone back from taking action. Consider this video as a gentle nudge to help yourself or someone you care about take that first step, paying attention to the signs and consulting a professional if something feels off. With this in mind, let's dive into the 9 warning signs every woman should know. Understanding potential symptoms early begins by knowing these critical warning signs. One of the most common signs of breast cancer is the appearance of an unusual lump in the breast or underarm area. Breasts naturally have lumps and ridges due to fatty and glandular tissues, so not every lump is cause for concern. However, if you feel a new, firm lump that isn't tender or doesn't move when pressed, it's worth seeking a professional opinion. A healthcare provider can do a simple physical exam and recommend imaging tests like a mammogram or ultrasound to confirm whether the lump is benign or needs further investigation. Have you noticed one breast looking different from the other? Perhaps larger, smaller, or oddly shaped? While slight asymmetry between breasts is common, any sudden change in breast size or shape could indicate an underlying issue. Pay attention to the overall contour of your breasts, especially if the changes are accompanied by tightness or pain. Dimpling or puckering of the breast skin can be a subtle but significant sign of breast cancer. This symptom occurs when tumors pull on the skin or cause underlying tissues to contract. If you see your skin resembling an orange peel, rough and pitted, it's essential to consult a doctor. Nipples that suddenly become inverted or pull inward rather than pointing outward are another potential signal. While some women naturally have inverted nipples, a new, sudden change like this should be evaluated. Discharge from the nipple, especially without squeezing, can be alarming. Different colors and textures like clear, milky, yellow, or bloody discharge can indicate different conditions. Although not every discharge signals cancer, bloody, or otherwise unusual secretion should always be checked. Breast pain, often associated with menstrual cycles or hormonal fluctuations, is usually benign. However, pain that doesn't go away or is localized to one spot might need further medical attention. Pain caused by breast cancer usually isn't uniform. It tends to persist and doesn't feel cyclic like periods. Swelling in the breast or underarm, even in the absence of a lump, might signal breast cancer. This could be due to tumors affecting lymph nodes or other surrounding tissues. Swelling that doesn't subside merits a professional evaluation. Red or inflamed skin on the breast might alarmingly resemble an infection, but it could also be a sign of inflammatory breast cancer, a rarer but aggressive form of the disease. If redness or swelling doesn't improve with antibiotics or other treatments, call your doctor. If you notice a persistent rash, scaly area, or itching around the nipple or areola that doesn't go away, it could be connected to Paget's disease of the breast, a rare type of cancer. While rashes may seem minor, don't dismiss prolonged skin changes until they're evaluated. Not every symptom means breast cancer, and not every lump needs to trigger panic. Understanding the reality of breast cancer can help ease fears and guide you to take appropriate action instead of worrying unnecessarily. Many lumps are benign and caused by other conditions, such as cysts or fibroadenomas. Painful lumps are less likely to be cancerous since most breast cancers are painless in their early stages. Breast cancer only affects older women. False. It can occur at any age, so younger women should also remain vigilant. Family history is the only risk factor. False. While genetics play a role, many women with no family history develop breast cancer. Relying on facts, not fear, will help ensure you stay calm but proactive in monitoring your health. Detecting breast cancer early can go beyond recognizing symptoms. It also relies on building good habits and seeking regular medical care. Here's how you can take charge. Begin by conducting monthly breast self-examinations, preferably a few days after your menstrual cycle ends, when hormonal changes are minimal. Step 1. Stand in front of the mirror and observe your breasts for visible changes in size, shape, or skin texture. Step 2. Raise your arms and look for similar changes. Step 3. Use the pads of your fingers to feel for lumps or abnormalities in both breasts and underarms. Move in small circular motions covering the entire area. Step 4. Repeat the process while lying down, as this position can help spread tissue evenly. If something feels unusual, don't wait, schedule a visit with your doctor. Regular screening is critical for detecting breast cancer before symptoms appear. Women aged 40 to 50 should discuss mammograms with their doctors and schedule screenings every 1 to 2 years. Women over 50 should prioritize annual mammograms. Younger women with family histories or known risk factors should begin earlier screenings as recommended by their physician. Awareness of your unique risk factors, such as family history, hormonal therapy use, or lifestyle, can inform your habits and ensure preventive care. While monitoring your own breast health is vital, don't forget the power of community. Supporting others and learning about breast cancer can amplify awareness and potentially save even more lives. Encourage friends and family members to perform self-exams, visit their doctors regularly, and remain informed about breast cancer. Sharing knowledge strengthens your circle and ensures no one suffers in silence or without hope. If you know someone facing breast cancer, offer your support. A kind word, an active listening ear, or simply being there means the world to someone undergoing such a challenging fight. Schedule a screening or gently remind a loved one to do the same. Make early detection a habit, not an afterthought. Always remember this. When it comes to breast cancer, you are your first line of defense. You have the power to detect warning signs, to act early, and to advocate for your own health. Today, take the first small step toward protecting yourself and the women you care about. Together, let's spread awareness, debunk myths, and fight breast cancer as a community. There is hope, there is strength, and with early action, there is a brighter future for all of us. Thank you for watching, and remember, knowledge is power. Take care of your health and encourage others to do the same. Together, we can make a difference.